Every morning, it is the same thing. You swing your legs off the bed, your feet touch the floor, and the moment you take that first step, your knees remind you they exist. Stiff, achy, like rusty hinges on an old door. You grab the wall or the nightstand just to steady yourself. You walk to the bathroom like you are 90 years old, even though you are only 55 or 60. And stairs? Forget it. Going down feels like someone is pushing a nail behind your kneecap. Most people accept this as normal aging. They pop a couple of pain pills and move on. But here is what nobody told you. That morning, knee pain is not caused by old cartilage or worn-out joints. In most cases, it is caused by muscles that have stopped doing their job while you sleep. And if you wake up those muscles before you even stand up, the pain starts disappearing, not in weeks, in days. Today, I am going to show you exactly how to do that. Here is what we are going to cover. First, I will explain what is really happening inside your knee when it hurts in the morning, because once you understand the cause, the fix makes perfect sense. Then I will show you a quick 10-second knee test so you can see exactly which part of your knee is struggling the most. After that, we will go through 3 specific exercises that you do every morning before getting out of bed and within the first 2 minutes of standing up. I saved the most important exercise for last because it fixes the one movement that causes more knee pain than anything else. So please stay with me until the end. Let me explain what is actually going on inside your knee. Think of your kneecap like a train on a track. When everything is working properly, your kneecap glides smoothly up and down in a groove on your thigh bone every time you bend or straighten your leg. You do not even feel it. But here is the problem. The track does not guide the train. Your muscles do. Specifically, one muscle on the inside of your thigh called the VMO. That stands for vastus medialis oblique. You do not need to remember the name. Just know this. It is a small teardrop-shaped muscle right above the inside of your kneecap, and its only job is to keep your kneecap centered on the track. When this muscle is strong, your kneecap glides perfectly. No friction, no grinding, no pain. But when this muscle weakens, and it weakens faster than almost any other muscle in your body as you age, your kneecap starts drifting outward. It goes off track. Now, instead of gliding smoothly, it is grinding against bone. That grinding is what you feel every morning. That is the crunch when you bend your knee. That is the sharp sting when you go downstairs. And here is the part that makes it worse. When you sleep, you do not move your legs for 6 to 8 hours. During that time, your muscles cool down, your joints lose lubrication, and that VMO muscle essentially falls asleep. So when you stand up in the morning, you are asking a sleeping muscle to stabilize a 15-pound kneecap under your full body weight. No wonder it hurts. The solution is not pain medication. The solution is to wake that muscle up before you put weight on it. And that is exactly what these 3 exercises do. But first, the knee test. This takes 10 seconds and tells you exactly where you stand. Sit on the edge of your bed or a chair. Straighten one leg out in front of you and hold it there. Now look at the inside of your knee, just above the kneecap. Do you see a small muscle bulge there? That is your VMO. Tighten your thigh as hard as you can while your leg is straight. Can you see that muscle pop out? Can you feel it contract? If you can see it and feel it clearly, your VMO is still active. That is good news. If you tighten your thigh and you see nothing, if the area above the inside of your kneecap stays flat and soft, your VMO has gone quiet. That is exactly why your knee hurts. The good news is we are about to wake it up right now. Try the test and tell me what you found in the comments. For example, I am Robert, 63 from Michigan, and I could barely see my VMO on either leg. Your comment helps others realize they are not alone. Let us get to work. Exercise number 1. I call this the bed press activation. You do this one before you even sit up in the morning. You are still lying flat on your back. Take a small rolled up towel or a pillow and place it under your right knee. Your knee should be slightly bent, resting comfortably on the towel. Now here is the movement. Press the back of your knee down into the towel as hard as you can, while at the same time straightening your lower leg and pointing your toes toward the ceiling. You should feel the muscles on top of your thigh tighten up, but pay attention to the inside of your knee. That teardrop muscle right above your kneecap. Can you feel it squeeze? That is the VMO waking up. Hold this squeeze for 5 seconds. Really focus on pressing that inner knee muscle as hard as you can. Then slowly release. That is 1 repetition. Let us do another one together. Press down into the towel, straighten the leg, toes up, squeeze the inner thigh hard. Hold 2, 3, 4, 5, and release. Common mistake. Do not just straighten your leg and call it done. The pressing down into the towel is what activates the VMO specifically. Without the towel, your bigger quad muscles do all the work, and the VMO stays asleep. That is the whole problem we are trying to fix. Do 10 of these on each leg. It takes about 2 minutes total, and you have not even gotten out of bed yet. Your knees are already warming up. The lubrication is starting to flow. The VMO is online and ready to stabilize your kneecap when you stand. Good. Sit up slowly. Swing your legs over the side of the bed. Before you stand, we are going to do exercise number 2. I call this the seated knee squeeze. Stay sitting on the edge of your bed or move to a sturdy chair. Place your feet flat on the floor about hip width apart. Now place a pillow or a folded towel between your knees. You want it thick enough that your knees are a few inches apart. Here is the movement. Squeeze that pillow between your knees as hard as you can. While you are squeezing, slowly straighten both legs out in front of you until they are almost fully extended. Hold the squeeze and the extension for 3 seconds. Then slowly bend your knees and lower your feet back to the floor. Do not let go of the squeeze on the pillow until your feet touch down. That is 1 repetition. Let me explain why this works. The squeezing motion activates your adductor muscles, the inner thigh. These muscles work together with the VMO to pull your kneecap inward and keep it on track. Most people only try to strengthen their quads for knee pain. They do leg extensions or wall sits. But if you ignore the inner thigh, the kneecap still drifts outward because only one side of the system is working. Think of it like a tug of war. Your outer thigh pulls the kneecap out. Your inner thigh and VMO pull it back in. If you only train one side, you lose the war. This exercise trains both the inner thigh and the VMO simultaneously. That is why it works so fast. Let us do it together again. Squeeze the pillow, straighten both legs slowly, hold for 3 seconds, and lower slowly. Keep squeezing the entire time. Do not rush. The slow speed is what builds strength. Fast movements let momentum do the work, and your muscles learn nothing. Do 8 repetitions. Your knees should already feel warmer and more stable than they did 5 minutes ago when you woke up. Now, before we get to the 3rd exercise, please take a second and hit the like button on this video. It helps YouTube show this to other people waking up every morning with stiff, painful knees who do not know that 2 minutes can change everything. Thank you. Now stand up. You should already notice that standing feels easier than it normally does first thing in the morning. That is because your VMO and inner thigh are now awake and stabilizing your kneecap. Exercise number 3 is the one that fixes the movement that causes more knee pain than anything else. Going down, down stairs, down hills, down curbs, lowering yourself into a chair. This is called an eccentric contraction. It is when your muscle is lengthening while working, and it puts 3 to 5 times more stress on your knee than walking on flat ground. Most people avoid stairs because of the pain, but avoiding them makes your muscles weaker, which makes the pain worse the next time you try. It is a vicious cycle. We are going to break that cycle right now. I call this the controlled step down. Stand next to a wall or behind your chair. Place your right foot on a thick book, a yoga block, or the bottom stair in your home. Something about 4 to 6 inches high. Your left foot hangs off the edge. Here is the movement. Bend your right knee slowly and lower your left foot toward the floor. Slowly. Count to 4 on the way down. 1, 2, 3, 4. Your left heel gently touches the floor. Now straighten back up by pressing through your right foot. Count to 2 on the way up. That is 1 repetition. The slow lowering is everything. 4 seconds down, 2 seconds up. The 4-second descent forces your quad and VMO to control the kneecap under load through the exact range of motion that causes pain. You are teaching the muscle to manage the stress instead of collapsing under it. Let us do another one. Bend slowly, 2, 3, 4. Heel touches. Press back up. 2. Common mistakes. Do not let your knee collapse inward. Watch your right knee. It should point straight over your second toe the entire time. If it dives inward, your VMO is not doing its job. Consciously push the knee outward slightly to correct it. Also, do not lean your body forward. Stay tall. If you lean forward, your body weight shifts past your knee and puts extra pressure on the joint. 8 repetitions on each leg. This is the hardest exercise of the 3, but it is the most important. This single movement retrains the exact motor pattern that causes 80% of knee pain in daily life. That is the full routine. 3 exercises, about 5 minutes total, the bed press activation to wake up the VMO, the seated knee squeeze to balance the inner and outer thigh, and the controlled step down to retrain the movement that hurts most. Do all 3 every morning before you start your day. My suggestion is to do them in this exact order because each one prepares your knee for the next. The bed press warms up the VMO, the knee squeeze adds the inner thigh, and the step down puts it all together under real-world load. Most people notice a difference within the first 3 to 5 days, not because their cartilage regrew or their joint magically healed, but because the muscles that protect the joint are finally doing their job again. The kneecap goes back on track, the grinding reduces, the pain fades. I do want to be honest with you, these exercises work beautifully for the most common cause of knee pain after 50, which is kneecap tracking problems from muscle weakness. But not all knee pain is the same. If your knee is hot, red, and swollen, if it suddenly locks up, or if the pain started right after a twist or fall, please see your doctor. Those are signs of something that needs more than exercise. The routine we learned today is your daily maintenance. But if there is structural damage, your doctor needs to know. My friends, you now have a morning routine that takes less time than making coffee. The bed press, the knee squeeze, the step down. You do not have to be perfect on day 1. If the step down feels too hard, skip it for now. Start with just the first 2 exercises in bed. Add the step down next week when your knees feel stronger. Small steps lead to big changes. Write in the comments which exercise you are going to try first. Come back in 1 week and tell me how your knees feel. I read every comment. If this video helped you, please hit the like button and subscribe so we can keep working on our health together. Your knees carried you your whole life. 5 minutes every morning is the least you can give them back. Take care of yourself. I will see you in the next one.